Good morning. Today we're going to go over Chapter 6, Geriatric Considerations. I want you to go over your key medical terms, your objectives, and just use all sources that you need to and are available to you. So with that being said, I'm going to go over the key points in the chapter. And so here we consider the aging population, the physiological changes with the reduction in the body water and lean body mass. You have the reduction in the kidney mass and the function. You have reduction in the mass of liver mass and the function. Reduction in the physiological processes that maintain equilibrium. We have to consider all of this when we're giving medications, because it does slow down the process and the metabolism of the medicine. It may actually break down the medication to a point that different dosages have to be considered. So over half of the older adults use at least one over-the-counter drug. Nearly 3/4 of the older adults use at least one supplement to augment their prescription drugs. So in older adults, they're more likely to experience adverse reactions due to these considerations, and many times resulting in hospitalization. So we have to be very careful. In this being said here in this slide, you want to administer drugs in older population. It requires special attention to age-related factors that influence absorption, distribution, metabolism, and excretion. Drug dosages could be adjusted according to the older person's weight. The lab results may indicate that they may not be able to take, say, for instance, things that are metabolized through the liver. And if they have reduced renal function, and you have to consider that in taking medications that are metabolized through the kidney. So dosages should be adjusted according to the, of course, the weight, like I said, the lab results, the comorbid health problems. Drug toxicity may develop in the older adult for dosages that are within the therapeutic range for a younger person. So, physiological issues, changes associated with aging can influence the absorption, distribution, metabolism, and excretion of drugs, and as well as the pharmacodynamic responses at the receptor sites and the target organs. Adults experience several GI changes with aging that influence the drug absorption, including the decrease in small bowel surface area. It's like if they have issues with the dumping syndrome, things like that, it's not going to actually absorb properly in the small intestine. You have the excretion of drugs as well as pharmacodynamic. That's what I'm talking about here. And then we will see that the some of the abused drugs will actually raise a tolerance level in the older adult, even though that it can affect their respirations. They have to consider certain drugs if they will take hypertension medicine. They are not going to be able to take some over-the-counter medication, and some potentially could cause hypotension in response to the blood pressure medicine. So you're going to have to make sure that before administering blood pressure medications, you need to take the blood pressure before you administer and make sure it falls within those guidelines. Now, also, volume depletion and dehydration, the electrolyte imbalances, diuretics. You have to make sure they're having enough potassium. Then you have to make sure that, say, with the example of the Lasix, it's actually pulls potassium. It's not potassium sparing. So you're going to have to supplement with the potassium. And now you'll see increased bleeding if they taken anticoagulants. Sometimes, like Coumadin, you'll have to have a PT and INR labs done to make sure they're staying within range. And with the antiplatelet drugs, but especially with the Coumadin. And now you'll also get a lot of GI irritation with NSAIDs. And they've also associated some NSAIDs now with causing issues with the heart. Now, the reduced gastric blood flow and 5 to 10% of the decrease in gastric acid production is going to also affect the absorption. And you have to look at the patient's cognitive ability and adherence to the drug and make sure they understand the drug regimen. The non-adherence causes either underdosing or even overdosing if they're forgetful. That's why you have to really monitor the geriatric patients. Now, barriers in effective drug use, and then the medication education is really important because all the different side effects that they can have with that. Now, also, you'll look over here and you'll see that because of the aging patient, they have experienced a decline of muscle mass 20 to 40% and an increase of fat. So therefore, medications can be absorbed in that fat tissue and not metabolized properly. Older adults also experience 10 to 15% reduction in total body water and a reduction in the albumin, the protein. So the hepatic blood flow in the older adult may be decreased by 40%. So aging also results in 15 to 30% decreased liver size and a reduction in the cytochrome P450 enzyme. So you want to look at that in the chapter, and is responsible for the breakdown of the drugs. Now, your liver enzymes always need to be monitored. You just want to make sure that you're teaching them in a way that they can understand, because you're going to have to speak louder most of the time. Speak plainly. Do not mumble. Just try to have good eye contact. With the generation of older, you need to be respectful. Always call them by Mrs. or Mr. and their last name, and make sure you confirm, because if they cannot hear you, they might say, yes, my name is, or just agree to a different name. And so you have to really make sure you check their armband and use the identifiers. Always make sure, with all this being said, safety is a big key. Always use large print. You want to make sure if they have trouble communicating, get dry erase boards, have it in their room, and have reminders for them. And, always, they may forget that you come in the room. So you may want to have on the whiteboard state and document the time that you've been in the room so they can see, because they may have family members that come in and they ask, oh, has the nurse been in? So you want to make sure that you are communicating through different procedures to let them know that you have been in. The family member really relies on the nurse to communicate that to if there's any confusion. Now, you continue to always review your medications with each patient. Advise the patient to complete the vial of live that instruct the patient to take the list of drugs taken to all health appointments. Just bring the whole bag in, because sometimes they will have a list of medications, but that doesn't mean that they're taking them all. So if they physically have to take that medication in, they're being responsible and have the actual bottle, and they'll know that, oh my gosh, I have been taking this medicine. So they'll have to make sure they visually see it and they can be questioned. Encourage just simple dose schedule. So try to divide it up. If they can, if it's a twice a day medication, try to take, if there's no interactions with the medication, try to simplify it and take it morning and then in the evening at a set time. Now, I'm just going to go over some, along with the slides. I want you to understand the responses of drugs and how they alter with the ages and the changes and the number of the receptor sites. If you want to get a little deeper, there's cholinergic drugs, there's anticholinergic drugs, there's antagonists, receptors, and there's medications. So just there's different ways it responds to their nerve receptors. And with aging patient, you have had some the structure of the nerve and the myelin sheath that is actually a cushioner and actually helps transmit the nerve response is sometimes altered. Now, the excretion, like I talked about the kidney function, you're going to have, because the renal size and the volume deficiency between the individual, the input and output needs to be monitored. And look at the table 6.1 and go over that. Now, the American Geriatric Society beer criteria for potentially inappropriate medication. Used in older adults is to document and develop a panel of experts that aid in the healthcare providers in the safe prescription administration of drugs to older adults. That's stated in the textbook. Older adults are twice as likely as younger adults to visit the ER with adverse drug events, and even several times as likely to be hospitalized. One for adverse drug reactions, and then second, for med errors, and it's just therapeutic failure of how it actually has worked on that patient. So, one size does not fit all with every a geriatric patient. And most visits to the hospital occur due to reactions to blood thinners, drugs used to treat diabetics, seizure patients, cardiac patients, and drugs used for pain control. And you'll see there's more indications of adverse drugs and withdrawal events with overdose, because a lot of physicians now are trying to stay away from what they call cholinergic medications. And with that being said, if a patient's been on a certain drug for a good amount of time, they cannot just cold turkey say alprazolam. It has caused a lot of different side effects for patients that have been taking them for a long period of time, and then it cannot be stopped. It has to be weaned. Now, here you just go over the confusion. Patients encouraged to report if there is any new drug that is not improving the condition. Like I said, one size doesn't fit all. And always, like I said, with the whiteboard, using memory aids. Or you can even, have pill boxes. But then when you're using pill boxes, you have to consider, the cognitive ability of that patient. Are they able to administer their own medication? You'll see a lot of this in home health. And so you want to assess the sensory cognitive barriers, assess the laboratory results, discern whether the patient lives alone or without social support, if assistance is needed with medications, including costs and transportation. You need to always go in and if you're go into the home health field and be an LVN, it's not all about just getting the vital signs, and your responsibility as LVN sometimes will be to fill the bill boxes, but you need to also remember it's you're the barrier or the bridge to the RN, and you need to find out and make sure that they are taking those medications properly. And if they're not, that needs to be communicated so different things can be implemented to aid that patient, especially if they live alone and don't have a family support to come in and collaborate with the home health, because so many insurances now will shorten the stay or shorten the time period they can be on home health. So it's not like it was in the past where it was easy to keep a person on home health care, especially if they fall in the window to where they have underinsured or they're don't fall in the Medicaid category. Those patients are the ones most of the time that really need that help, but they don't have the funds to have sitters around the clock. Now, the nursing process here, you want to know, and the nursing diagnosis, what are their diagnoses medically? So therefore, what a medical, what not only medical, but you got to look at the nursing diagnosis that correlates with the health maintenance. So there's a lot of knowledge deficit. There's different, I want to say, social barriers because of the fact things, people, older generation, especially if it's a widow or a widower that has relied on their spouse, they are sometimes very dependent on other people to help. So you have to really assess those things, not only cognitive, but their social history. So here we go with planning. So we have to we have to plan, make sure that they collaborate the healthcare providers and develop a therapeutic regimen. Just like I said, with the LVN, they're going to be that communicator because the RN only goes in for supervisory visits, the start of care, usually the recertification, which in that window can be 3 weeks before they come in. They don't go in every week. Very, don't just go in there, oh gosh, I got 20 patients today. Let me get in and out. Just make sure you're covering all the bases because you're put their lives are in your hands and their health is in your hands. So always take that in consideration. You know, you're going to be there. You're going to have access to their lab results. Make sure they have had lab results. If you don't see that they have had it, communicate. If something's been missed, like for instance, Lanoxin, you'll see a lot of people on Lanoxin, which is a digitoxin med, and you want to make sure because the toxicity can build up in their blood and cause a heart block. So you want to make sure those labs are been drawn every 3 months on that particular med because you're going to see a heart. If you feel a pulse rate is gone down below 60, there could be a medication reason for that. Observe the adverse reactions. If you see any types of symptoms, any increased edema, you want to make sure that there is an alert and a change of weight. Always weigh the patient because you want to go in and see if there's a sudden increase in weight or a sudden decline in weight that can show that those patients are confused and haven't been eating. Remind the family, and hopefully they do have family, and to tell you on the over-the-counter medications. Really, if you see expired medications in their cabinet, don't feel like, oh, you're being nosy. Really go in there, see if you see expired drugs or anything, something that they shouldn't be taking. Communicate to the patient that you should really discard those. Advise the patient and the family to request non-childproof, because a lot of arthritis, whether osteo, rheumatoid, usually the autoimmune diseases have set in on the geriatric patient. You just want to have a good evaluation. So I'm going to go over some more things that I feel like are important. Non-adherence with the drug regimen can be a problem with patients in age groups, especially in older patients. Older patients may fail to ask questions. They believe in that generation respect the physician and don't ask questions. It's getting to where the upcoming geriatrics are a little bit more educated, but the elderly that do not get on or have access to a computer, they just rely on what the doctor asks. And the many primary physicians aren't getting information from those specialists, and they may prescribe the medication that will be have a contraindication with the medicine that they're taking from the specialist. Review table 6.2. I always encourage pharmacy and patient care. Someone's at your door. Excuse me just a second. Excuse me. Encourage clients to give a list of meds, including what we've already gone over, the over-the-counter, any kind of herbal medication, vitamins, to the pharmacist. So the pharmacist can coordinate and make sure that there's no side effects or any contraindications or adverse effects that could be caused by those. Now, you want to make sure when you're working with the geriatric patients, it's an ongoing nursing responsibility, that the nurse should plan strategy with the patient and the family or friends to encourage adherence with the prescribed regimens. May need to fill a med planner out for them, provide a calendar, set alarms for them. Most geriatric patients do have cell phones now. If they don't, you can have other alarms that they can have. Provide something for them. The Medicare Modernization Act in 2003 made it possible for older adults to obtain prescription drug coverage through Medicare. Older adults eligible for Medicare Part A or Part B are eligible for optional Medicare prescription drug, which is Part D, or coverage through Medicare Advantage Plan, Part C. Assess patients' ability to pay, because make it available for indigent drug programs. There's so many different things. There's lists that you can get from, say, Sam's or Walmart, or different comparisons that we can make for the patient, be that advocate, and show them if they do not have a specific supplemental insurance, that we can let them know where is the best place to buy that medication. Because I know when I did home health, I would go out and I had to get a list from, make sure we'll see if they had a Sam's or if they had Walmart, that they could get to where they would print out a med list and how much it was for the geriatric genetic the actual genetic drug. So with that, the Medicare is good in so many ways, but you have to really make sure you inform them, because certain Medicare that they advertise on TV might be not available, or the doctor may not accept it. So you really need to know coverages too. That really helps. Healthcare professionals um, need to work collaborative to enhance safety and adherence of older patients, and to avoid errors and unwarranted concerns. Nurses are in a good position to where we can be that advocate for the patient, and really help them know the therapeutic regimen. And another thing is, there's partnerships for prescriptions assistance. You can go to, and you can write this website down, www.pparx.org and www.ssa.gov/Medicare/prescription help. And that really is helpful. So you may want to review those things. So, all right, that concludes this. I want y'all to look over these practice questions and know those. That'll help you. And have a good day. Thank you.